agencies, just so you guys know what's going on. It would only be going to agencies, so. Okay.
Awesome, Miss Steele. Well, you guys are gonna see my beautiful face.
Yeah.
Well, good morning. Thank you for having me here today. Sorry if you guys are getting half the view and you guys are seeing some of the view. My name is David Mercado. I'm the Senior Director of Operations at United Way of North Carolina, the state association here. This is one of our phenomenal United Ways. I have the pleasure of spending a lot of time with Brett and his team. So the goal was to come.
Send him sympathy cards.
Yes. Yes, you can send me, Brett can cash at me the $5 for saying that. But no, so, part of the state association that we offer is just a couple of things that we do. So we service 100 counties across the state. So we have 47 local United Ways. And what we do is, we're part of the emergency response unit for the search. So if there's an emergency and disaster and they activate 211 gets activated, and I'll talk about 211 in a second. But our main goal here is to partner with our champions, which are the United Ways, and our agencies, in order for us to be beneficial and fruitful in the work that we do as a whole, is that we need to all be on one accord. A lot of the stuff that ends up happening is you have a big discrepancy. We talk resources, we talk what services are being offered, we talk how do we talk to consumers. You're going to hear me use the word consumers because I call our people to call in consumers. Reason being is if somebody's getting something for free, you treat them like, huh, whatever. But if I'm selling a service, then you're going to really feel like you're getting something out of it. We have talked about right now how we want to get people to utilize our services that we offer. So one of the big services we offer is 211. It's statewide. We're open 24 hours a day, 7 days a week. When I came in on board, my background, just so you know, I came from New Jersey's 211. So I ran it for a decade. A little bit different because we weren't associated with United Way. Yes, United Way was in our network and they were one of our resources, but we were more working with the state. So completely different concept. So when I came here, I came into a very interesting situation. So where people were like, I don't like 211. The wait time is 4 minutes, it's 3 minutes. It's people are hanging up, there's no resources. That's the reality, right? We're going to talk about evolution. You'll never hear me use the word change. I evolved 211. So the current state from 2 years ago, we're at a 15-second hold time, 24 hours a day. Our resources went from being 13,000 resources to over 17,000 resources. Our staff are having key metrics that they have to hit. Metrics are not like rushing people off the phones. It's quality, making sure that they're getting quality calls when they come in. When somebody's calling in, I listen to a lot of calls and I'm a very rare breed of person. Like this morning, I ran 10 miles. In my run, I listen to calls. People laugh at me. I download the calls and I put them in and I listen to them because I even take calls. Running the organization, I need to understand who's calling and why they're calling, right? One of the things when I first came here was we don't have that resource, and then you give no hope. You've already shot the person that's calling in. So is teaching our staff and teaching the community how to think outside the box. Completely different, right? You guys know, being in agencies, the biggest resource that people are calling for is housing. And we know that there's very little sometimes for that is out here in the whole state of North Carolina for housing. So what we had to do is change the mind frame and evolve it to a different level of our staff to realize like, okay, well, they might not be anything for housing and you're looking for rental assistance, but are you paying for your electric bill? Are you paying for your water bill? Are you paying for your cell phone? Let's see if there's other stuff that can help you and save money here so you can use that money that you saved and pay for your rental assistance. When people hear that, they get hope then because of the fact that there's agencies that'll be saying, hey, we have funding at this certain time, but then we lose funding and then all of a sudden funding comes back a month later or whatever it is. So one of the key things for us with agencies, and I'm glad that you guys had me come talk to, and even having the conversation with agencies, is to let you know how important it is to update the information. So in every county that I speak at, and when I go, I speak to so many different people. They like, oh, well, we have this sheet right here, this sheet of paper. These are our resources. The moment you print that sheet of paper, it's obsolete. I'm going to tell you why. Phone numbers change, hours of operations change, contact persons on there change. And they don't update the person that created that piece of paper. Like, and it happens in everywhere that we go. So for us at 2-in-1, we have a resource team of we have 5 resource coordinators and a manager. And if you look at the Medicaid map, that's how we kind of have it. So assigned to Brett and his team is 1 resource coordinator, and we're updating resources every day real time. So the way this works is if your agency is on our database, you'll get a phone call once a year to vet your resources. We vet them once a year. Our goal is we've actually just we unveiled a new dashboard to our local United Ways so they can see who on our network is active and inactive. Because sometimes you'll say, I have a local United Way call me, well, I don't see this person in our resource database. And it's because we haven't vetted them. So we're not just going to keep people on there to keep them on there. If we can't communicate with them via email, phone call, we're not going to check the website for them. And I'm going to tell you that in a second, the reason why. But if we can't have a verbal communication or written communication that everything is still the same, we're going to inactivate them from our website because of the fact that we don't know if they're still offering that service. And let's say that somebody gets, we do Lyft because of the fact that we're doing the Ride United. And I get somebody to the location and they only qualify for 2 rides. And they get there and they can't get a ride back because the place is closed. So we're very adamant about making sure that resources are active. A lot of the United Way is like, no, but I know that they're there because I spoke to their director today and I know that they're offering services. So this is where it happened. Like, let's say that there's a small church that's offering food pantry services. Everybody on that church is volunteer, possibly. They're not updating their website. They're not updating their phone numbers. They're not updating any of that kind of stuff, right? So if something's not accurate, then right there, we send somebody on a Tuesday. Well, that volunteer can't work anymore on Tuesday because they got a job. Now they're going to change their food pantry to Wednesday. Nobody gets notified. We shut them off. We make them inactive. And then the good thing here is it allows you guys to see who's in your network. So I'm going to show you guys a few tools that we have. We have our website, which is NC211. Anything that I'm going to show you is connected to what our specialists see. Obviously, they're not going to see it like this. They're going to see it a little differently. But everything that we say to our consumers is the exact same thing that's on the website. So if you're an agency and you give us, hey, listen, we offer rental assistance, blah, 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 blah. And then you want to give us a caveat, please do not share this with them, but we only are doing X, Y, and Z. They won't see that, but our staff will see that. I'll give you an example, Salvation Army. They tell us funding is available on the 1st and 3rd week of the month. We know that, but it says, please do not share that with the consumer. Reason being is because of the fact that they might not exhaust their funding from the 1st week of the month. So it might go into the 2nd week of the month, right? So if we tell them, hey, it's only the 1st and 3rd week, they're only going to get phone calls on those first. No. So what we do is if somebody calls us on the 2nd week of the month to say, hey, I called the Salvation Army, there's no funding available. Okay, now we can say, well, funding is first come, first serve. Why don't you give them a call back in a week? We understand that 3rd week, they might potentially get it. Another one that we did was for Duke Energy. You guys know that energy calls are huge. Everybody's calling for energy. When I first came on board, North Carolina didn't have a big footprint, 2-in-1, of the whole energy situation. Coming from New Jersey, we were part of the Utilities Commission. So what happens is I had my own campaign at my 2-in-1 for utility help. And then the LAHI program and all that kind of stuff, we will help register people to the LAHI program. So when I first got here and I realized that Duke Energy was sending out lovely messages to people to call 2-in-1, on a Monday, our call volume tripled because we were getting these phone calls to say, call 2-in-1, they can help you find energy help. So I reached out to Duke Energy and I said, hey, listen, I want to know your collection process. And they're like, excuse me? I'm like, I just want to know your collection process. I want to understand that if somebody is delayed, what's their thing before they get shut off? So all of our staff is completely trained to understand. So if I get a phone call from Brett today saying, hey, I'm behind on my utility bill, I just got a disconnection notice. I know where he is in the program and I can teach him how he can save himself from being disconnected. So currently that's not something that'll show up on the resource, but our staff can say, hey, well, I see here, if this is your first notice, you have to pay, you can make a payment arrangement and pay $20. And if you make a $20 payment arrangement, they'll push that out for 6 months and they'll break it up into payments. That's stuff that that normal consumers won't know. So this is something that we can help them so they don't feel obligated. Now, granted, let's say people forget and they renege on their payment arrangement. We have that next. Okay, you reneged on your payment arrangement. You can make another one by paying 25% of the full bill. Now they're like, well, I don't have 25%. Well, it's easier to go to an agency that's offering services and help and saying, hey, you know what? If I make this 25%, they'll let me keep it on. An agency might be willing to give you $150 compared to $1,000. So these are the things that we really push for our resource coordinators to make sure is accurate. So showing you guys up here. So I'm gonna,
I'm gonna say something from the,
Uh-huh.
this is where I get in trouble. I'm gonna say something from an agency perspective that they will probably start kicking the table for. The way I look at 211 is we used to have our own INR show. We used to have a 1.5 people. And they would sit in the United Way office back on Davie Avenue and they would answer calls during the day from, I think it was 10 a.m. to 2 p.m. or something like that. And they would try to connect people to stuff. And we paid quite a bit of money to have that service active in our county. David and 211 gives me and gives you access to a call center 24/7, 365 with a lot of bells and whistles that y'all don't have to pay for. We do pay a little bit for it, but y'all don't have to pay for it. And so that's a tool. That's a gift. And so I hope what you're looking for in his words today is how can I use it to ease the efficiency of my shop? Like, we're gonna talk a little bit about turning on and off your profiles, like when you want people to be referred to you, when you don't want people to be referred to you. But he is pretty aggressive in helping make good things happen. David is not one that's scared of new ideas and change. So I'd be thinking creatively too. Like if I had a call center, how might I use that to do the work that I do? So now I really owe you money more than that $5 that I told you before because I put you on the spot a little bit. But it's a tremendous asset. I get a report every month about how many people call 211, and we're averaging, I think it's 4 or 5 calls a day right here from Iredell County. We get to track what those people are calling for, what they need, did they get help, what didn't get help, and all of that is great data. And we're going to talk a little bit about how you can request some of that data to make your case too. And it's just from the other side of the table, from your heads, because I'm a little bit in your heads. I just wanted to throw that in there before we get into the actual meat and potatoes.
No, and also think about why consumers call, right? Like that's something I want you guys to really think about it. I don't know what your agencies are. I don't know who you serve and it's a good thing because for me, then I'm just talking out loud and you guys, if spaghetti sticks, like I always used to tell my grandma, like she'd make me cook spaghetti. If it sticks on the wall, it sticks. But I want you to think about what we do at 201. So we have multiple campaigns that come in. So 201 is just our basic line. People are calling in looking for information and referral. We also have the caregiver program that we help seniors. You know, caregiver is not only about seniors though. It's anybody caring over somebody over the age of 18. I'm the caregiver of my son that's disabled. So like that's being a caregiver. Most people don't know that. So when they call in, they think when they hear caregiver, they think you have to be somebody that's a senior. No. So you're caring for somebody. There's different benefits out there that you might be able to qualify for that we can connect you with, right? One of the programs that's amazing that we offer in the state of North Carolina is our digital program. A lot of people don't even know it exists. So right now we're moving. We were just talking about cell phones with my mom and you know how like going from like an old fashioned flip phone to a newer phone and how it's just all crazy. So currently we partnered with the Department of Information and Technology. If you call in, nobody's calling in looking for digital help. They're calling in for other resources. But one of our partnership is when we place you on hold, we ask you, would you like to know information about the digital program that we offer? And most people are like, well, what do you mean by that? Like, would you like to know how to create an email? Would you like to know how to get a resume? Would you like to know how? And we go through different services and they're like, absolutely. We started this program in August of, it's been a year and a half now. August of 2024, we've already helped out 48,000 people in the state of North Carolina. And it's great because of the fact that we've helped them out find low income internet. They're not just calling devices. They're looking to see, hey, you know, I need a computer. Obviously, we're not giving away free computers, but we have organizations that might be offering computers that, that are refurbished for free, depending on the areas that they're at. We go through North Star, which is a training facility. So like, let's say that you want to learn how to use Microsoft Word, something simple. I just want to learn how to turn on my computer. We have navigators that are inside that can help you, but then we can actually set you up with a course that's free. And you can do this course little by little. We've partnered with 2 organizations across the state. We're looking at bringing on more that are doing digital navigation in person, where you can go to a library or church where they can come out there and have it. Right now it's Cooperative Extension, and I think CDE is the other one that we're using that's based out of Charlotte. But this great. We actually present the person, hey, listen, this is who's going to do it. If you didn't want to do it virtually, because so many people have been digitally scammed. So they're like, oh, I don't want to do anything digital because I'm afraid I'm going to get scammed on the phone. So then we offer that in-person one, right? So these are things like, and I'm just using some of them right now. We have taken over for Region 1 and Region 6 for the COC for housing for coordinated entry. So we are looking at continuing to add more campaigns that we do. For Winston-Salem in the city of Forsyth, we are their coordinated entry. We're their entry point. So as we continue to add more campaigns, like we just added Ride United, next year we're looking at expanding VITA through the whole state. We're doing VITA right now for 2 counties. So these are things that we're able to do at 211 that can help you guys in your areas, depending on what you guys are doing.
Pull up that Ride United, because we hear transportation with all of them.
Yeah.
Yeah.
Yep.
So what David's mentioning when he's talking about that is they have a partnership with Lyft where they get a certain number of rides. And if somebody calls and says, I don't have a way to get there.
Yep.
If they qualify for the program, David can say, is there a Lyft driver that can get you there? And we might be able to help you with that. Did I say that correctly?
100%. So there's 2 ways that we do that. We can either offer them a coupon code. So like right now, I was telling Brett, I brought my beautiful family from with me on the trip. And the hotel we're staying at didn't have indoor pool, so it's too a little cold to go outside. And my beautiful daughter, who's autistic, wanted to go swimming. So luckily, the YMCA that I'm a part of is nationwide. So I went to the Y here, which is amazing, and I took a lift here. I was like, well, let me see if it's available because obviously I didn't utilize the service from 211. I just dialed up, and it cost me $5 and something cents to get here on Lyft. So the way it works for us is we offer one-way trips, coupon codes, $26. In your county, that'll get you through the whole county, right? And it can, to and from, it can be for doctor's appointments, it can be for food, it can be going to social services, it can go to, there's so many things and there's so many loopholes for it. So when I say that, it actually goes for anything and everything. We were issued 600 rides since the beginning of January. We've already used 300. We'll get more. So we always tell people, like, these are things that people don't know that 211 offers. And then if somebody hits their ride limit, because there is a limit, because we're not going to let the same person use 600 rides, there's ways for us to request more for that person. So what we do is we find out the reason why. And then, like, let's tell somebody, hey, my car is in the shop or whatever it may be. Then let's see how we can help you get your car out of the shop. Maybe there's a different funnel there, so we're not utilizing just those rides. So with these, yeah.
On that lift though, when they take them, do they wait on them or do they?
You can do it either way. So there's a cool thing called concierge, and that's what I was doing right now. Before getting here, we set somebody up because of the fact she didn't have a phone, so she couldn't do the ride. So we did the pickup, the delivery and pickup, and the driver stayed. So and then the good thing is, depending on your area, some of the rides are more expensive if there are a lack of drivers in your area. But like this morning, it told me if I was willing to wait 7 minutes, the ride was $5. So what we do is we tell the consumer, we don't really give them that choice. We say, hey, listen, we have a ride that can be to you within the next 15 to 20 minutes. And they're going to be happy because they're getting the ride, right? And then we tell them also, we can schedule your pickup at the same time. Okay, so those are just a couple of things before I go into what 211 is and how we can help you. So this is our resources, right? This is 211.org. That's not on this one?
No, it's, minimize it.
Okay,
And
hold
then
on.
hit the share button on the bottom.
Oh, I
of
got
your
you. I got you. Hold on.
screen.
No, I got you.
Challenging.
Nope, not at all.
Thank you.
Yeah. You know what it is? I do three, but you're going this way and I go this way. So that's why it's okay. Hey, listen, it's okay. So this is 211.org. So this is free for anybody that can go into, right? Like there's no like, oh my God, you're paying for a service and whatever it is. And I'm looking for services before I go into show that what we're looking for. I'm going to go down and show. So this is where you would search. I'm looking for whatever. You'll put your state, your zip code or your address or your city, and I'll find help. We're going to go through that in a second. See, some questions there. Some people might not know what they're looking for. So, hey, it's better to go in basic needs, consumer services, criminal justice and legal, education. These are called hot topics, right? So the hot topics here are simple. Like, hey, people can go in and look for things because as for me, depending on the consumers and who we're servicing, right? They might need a person to help them walk through it. That's where 201 comes in, right? Like if you get somebody that's just like, listen, we call it crisis moment, and I don't understand, most people don't understand what that means. Any problem can lead to a crisis. A simple problem. I'll give you an example, and this is what we train in training. I am about to get evicted. If I don't get this job, I'm going into a job interview. I just got a flat tire on my way to the interview. I call 2-1, oh my God, I don't know how I'm going to do this. I'm freaking out. That can go to a moment of instability where it goes to crisis, and the person says, you know what, I just want to kill myself. We average 2 to 3 crisis calls per day, is what we're currently averaging. People calling in like, hey, so now we partner with 988. We have to do an assessment, a lethality assessment. Like, so the moment if Brett tells me, hey, I just want to kill myself, now we change the mode from let me help you here to, hey, Brett, I'm gonna ask you this question. You really want to kill yourself? Notice how I changed that mode? And Brett's like, no, I don't really want to do that. I'm just frustrated. Then, okay, Brett, you know that, let's see how we can assist you to find these resources that can help you. Brett's like, I really do want to do it. I'm done. Okay, Brett, do you have the means to do it? We have to go into a lethality assessment because now my specialist is asking those questions. The supervisor has the cops on the line on the back end to determine if we need to send somebody real time to go assist, right? Or to determine if we're sending a 988 to see if we just need somebody to have a conversation with. But now remember, that need is still there. They still got a flat tire here. But we also want to make sure that they're taken care of first. So we go through these basic needs, and I always say that because when people are looking for different assistances, they don't really understand what they're looking for. One need when they call in to 211 might be for food, but they might have 5 other needs. So this is where we tell people, the agencies, it's good for people to go on there that know what they're looking for, but if people really do need their assistance, it's better to have that conversation with somebody that can walk you through what your problem is. So as we go down a little further, talks about what 2-1 is information and referral service provided by United Way of North Carolina and powered by the local United Ways. That's really important to me because it used to be, oh, this is powered, by United Way of North Carolina. No. It's powered by the network, and the network is our local United Ways and the agencies that we support. Families and individuals can call 211 or the 888 number. Somebody said, well, if you're 211, why did you put an 888 number? Not everybody in North Carolina has a North Carolina cell phone. So it goes by your cell phone. So if I were to dial 211 because I got a New Jersey number, it's gonna throw me to New Jersey 211. Now, granted, we are such a huge network that New Jersey is going to see that and have that conversation, and they'll be able to transfer them into our line. But some people, like we always give that accent, and some people's phones won't dial the 3-digit number. Somebody's like, what are you talking about? That it depends on if they're having a rotary phone. It's really crazy. So we give that 888 number. So somebody asked me the other day, like, well, why the 888? I'm going to tell you right now, we give options. It's free and confidential. So everything that's given to us, we do not share anybody's information. So the data and I call it the analytical data that we give to our local United Ways, is all based on demographics and high level. So when I send stuff to Brett and his team, they're just seeing what type of calls came in, met needs, unmet needs. Somebody's going to say, well, how can your met need be the same as your unmet need? Simple. Some people got help with housing. Some people decided not to take the help for housing. Maybe they didn't qualify for that help. Maybe they were over income. Maybe so that's why we want to be able to give our local United Ways to go to, whether it's the county and the different officials to say, hey, these are our met needs and these are our unmet needs in our county. These are the issues that we have. We can talk about how many digital people were served in their communities, monthly. So they know like people are using the service, how many new resources were added, how many new agencies were added. That's important too, because now at that point, they know that their network in their area is growing, right? What I
You
might,
pay attention. I'll just tell a quick story. I had a conversation with Representative Parker not too long ago. He said, "Oh, Brett, any accounts that are at Marshall Christian Mission and I were talking about you." And his Lord, I'm in trouble now. And he said, "We were talking about the 211 reports you guys send out monthly and how helpful that is to see what's going on about one. If you don't get them, you want them. I do have an email list. I'm happy to add you to that. But, our elected representatives do value that information because it helps them figure out what's going on the ground in their community. That's who they're here to represent. So they are paying attention. So it is a great resource and it's a great opportunity to make your case for individual areas of access. We'll get into data
Yeah.
appeals and layers and everything.
yeah, and the most important thing about what we offer, we're offering the partnership. Like, this is not something that's additional cost. Like, I'm not, when Brett says, hey, I'm looking to do a grant, can you get me this amount of data, whatever it is? Obviously, if there's certain data pools, we have to have different types of conversations. But for the most part, if it's a simple data pool, it's just, hey, this is what you had came in, this is what it is. This is what I created a year ago when I was going to the local United Ways. I was like, I need to know what trick, like what's tickering you to move? What do you need? Oh, I need to be able to talk about 2-1. I need to be able to show who's calling in. I need to show this. I'm like, well, I'm going to put it at your fingertips. At one point, we were giving it to them weekly, but then it was, and once a week was great, but then they were, like, hey, can I get it monthly? So the consensus is give it to me monthly, which was fine for me. So we just changed it over to a monthly thing. And I can see that when the people that are using our data sheets and our analytical reports, their 201 count has gone up. So as they're starting to tell people about this in the community, we start seeing the call level go up, which is great. We're able to sustain it, but also you guys get more information on it. So a couple things we'll talk today is you need to speak to a person, you dial 211. I'm going to show you guys my friend Ben, which is Code the Dream. If you guys have never done this, this is good for agencies. So if you guys are client facing, okay, I'm going to talk through this in a second, what it is once you're client facing, because of the fact that you can go in there and it can actually help you do a one-stop shop for everything, and I'll show you. And then want to be listed in as an agency. So if you're not an agency and you go and you check it later on, you're not on here, you can actually just go right into being an agency and you join our database and it goes through. And I'm very, very specific with this. So all these come to my database manager. So contact name, email, you put all your demographics in here, agency information, agency description, want to put exactly what you guys offer. Like, don't say, hey, we offer food assistance. Well, what type of food assistance? We offer assistance, like maybe your clientele is only for single families or single mothers with children. Like, that's it. That might be your only clientele. Put it there because the more you give us, we use taxonomy. If you don't know what taxonomy is, how we code you in the system so that when a specialist is searching, they're going to put in certain keywords. And once that populates, it's going to show us these are the resources that are available. The worst thing we can ever do is send somebody to an agency that doesn't offer the service for them, or they don't qualify for the service, right? So when you add all this, it sends over an email to our manager and it initiates a phone call, right? We're going to check everything you sent. If you have a website, you don't have to have a website to be on our database, by the way. Some people think that you have to have an active website. That's not it because some people don't have a website. But, anything that you do put here, we will validate everything. And then once we validate it, we're going to call you. And like, hey, just letting you know what the parameters are that, hey, we're going to be calling you once a year to update. If there's a change in your listing, reach out to us. And then he or she is going to provide you with their contact information. So you don't have to do this again. You can actually reach out to your resource coordinator in your area. So those data sheets that Brett has, it actually not only tells you how many agencies are added, but it says if you have an update, reach out to this coordinator, and it has their name. We have plastered their name. I always joke around. I'm like, you guys are all over the place on purpose because I want people to know, like, they can update their listing because I understand if you're a team of 2, if you're a team of 1, you don't have time to update listings. You don't have any of that stuff. You don't have time to go into the website and do this. You barely have time to fill out your financials. How are you going to have time to fill out a listing? So it's better like you just tell us, hey, this is my update listing. Can you do it? You don't have to do anything but let us know. We take care of all the back end. We do everything and then afterwards, we'll send you a recap of what the picture looks like and saying your resources are updated and we'll show you how it looks. So then you're like, no, there's something missing here. So because we always want to get that buy-in to understand. And then if your listing changes, just be honest. Hey, you know what? We were offering assistance for rental assistance, electric assistance, and let's say transportation. Transportation fell off, we're no longer offering it. It's okay, we'll just update that in the system. But if we keep on seeing it there, because what we'll get is agencies call us after they're frustrated, after 10 consumers have shown up, saying, hey, we don't offer transportation, we'll have you updated your listing. See, and that's, remember I told you guys when somebody prints out a printed sheet, it becomes obsolete because it says on there transportation, but then all of a sudden that changed. So I'm going to go back for a second. And I'm going to start with my friend Ben first. So my friend Ben is a partnership that we have with Code the Dream. So like I said, you can give this to you can give this to consumers or as an agency, this is perfect. And I'm going to show you, it's very golden. We talk about evolution. When I first started my friend Ben wasn't what it is today. It was just basically, it was going to give you state resources. And what I mean by that, it's going to give you what you can do for long-term resources and what you can do for short-term. And I told the person that was doing this for us, I'm like, this doesn't work for me. Like short-term telling me you can go to the diaper bank or the food bank of North Carolina. That's not going to help me when I need something today. Like I need it next door or whatever. So now I have it tied into our 211 database. So now it's reading from 211. So what I'll do is we're going to get started. And it tells you about a little disclaimer. My friend Ben is a tool that can help determine benefits you are likely eligible for. Here's what you can look for. And I'm going to say yes, proceed. And I'm over the age of 13 years old. I hope I am. So can somebody give me a zip code here? 28677. There we go. So you notice how it populated automatically for you. And it's going to ask you questions. Everything here is never going to tie it to you. So it's not going to ask you your name. It's not going to ask you your date of birth or any of that kind of stuff. If it does that, it's going to ask you your date of birth for age purposes, but it's not going to go into saying, can I get your phone number? None of that stuff gets captured here. At one point, it asked you, would you like to give your email? Because if a new listing come through, they'll email you the new listing, which is good. Like in case that you're, somebody like, hey, I'm looking for food assistance and we added a new database listing that might qualify for you, they'll send it to you, but I'll show you that in a second. So here, as I go in, my household size, we're going to go with 3. We're just going to make it simple because I can make it 10, I can make it whatever. We're just going to do 3. So we're going to do a listing of 3. And notice how it doesn't ask me the date, just the birth month. So we're going to just say I'm a January baby. And I'm not going to put my real year in there, but we're just going to put something like, I don't know, 09. Yeah, we're just going to put 09. And it's going to ask you, what type of health insurance do you have? So we're going to go with the basic that we don't have because half of our consumers that are below the ALICE threshold, they don't have insurance. They choose not to get insurance because that's a way for them to cut back. I know that the taxes and they hit you with a penalty. I'll take the penalty, but I need the money in my pocket during the year. So we just say, I have no insurance. Does any of these apply? I'm a student. Pregnant, blind, currently have any disability, any medical. We're going to say that my wife is pregnant. It says here, enter income for yourself. You can enter income for the whole household members later. So they've made it that you can choose what type of income you have. So you have wages, salaries, self-employment, anything here that you're getting, even if it's unemployment benefits, cash assistance, whatever, you can put it in there. So I'm going to say that I'm working.
What he had two those.
You'll see. You can put it down even as the other person. It gives you an opportunity to put here if there's add another income at the bottom. So if I'm working 2 or 3 jobs, because there's so many people that need to work extra work. So we'll add one in a second. So frequency, I'm going to say I get paid weekly. And we're going to say that we're making $300 a week. Okay, just for the first income. Maybe it's a part-time job. It could be whatever. And we're going to add another income, and it's going to give me here. And I'm going to say the same thing. Now this one, I'm going to say I'm getting paid every 2 weeks. And let's say that I'm making $550. And I'm going to continue. So that's my annual income right there, based on what I put in. Okay, so I didn't have to do anything. They're not validating anything. It's just so we can see what they qualify for. So then I'm going to go a little further down. Tell us about the next person. So we're going to say February, birth year, and relationship to me is my spouse. No insurance at the moment. And we're pregnant because I always laugh when they say, who's pregnant? No, we are pregnant. Do you have income? We're going to say yes. Now here, we're going to just put we're going to put tips, whatever for wages. And we're going to do the same thing, but we're going to put her every month. And she's making $900 a month. And then we have a child. So there's the annual income for both family right there for both of them. Now we have a child. And I'm going to still put that there's no insurance because I want to show you what it'll do for the children differently. This child's not pregnant, there's no income. So now the system itself is going to have me tell us about what expenses we have. Right? This is where I say it's amazing because it can show them what, like they might not know they can get help on certain things that can help them long term. Because I'm thinking like, if I'm stuck and all I want to do is figure out how I can support my family and feed them, that's all I want is food. But I might not realize that there might be some electric assistance or something else somewhere else that might be able to support me, put money back in my pocket where this food is not going to be that big issue. And where I can start putting a little, and we're not talking about even saving money. I'm just talking about how do we survive to go to the next day. The reason why I'm so passionate about this, I was a single dad of 3 children. I'm going to share a quick story with you guys. I played professional baseball, got hurt. I was running a contact center in Florida, and I was making $50,000 a year, 3 children. Everybody thinks Florida is the place to be. Florida, that's no money. My children's mom, I wasn't married to them, put me on child support, and the kids were living with me. So they were taking 40% of my salary. I tried to fight it. It took me years to get it back. 40% of 50,000 was going to child support when these 3 children were living with me. So I applied for food stamps, thinking like, hey, let me apply. And in applying for food stamps, I ended up, they said you're approved. I was so excited. They gave me $11. I called the lady and said, Sarah, what the hell am I gonna do with $11? She said, you can decline it. I said, no, I'm gonna take it. And I bought 2 10-pound bags of rice a month. And that we ate just rice and beans. That's all we ate. We couldn't. It was just no means to it, right? But for me, I didn't have a 2-in-1 that can tell me, hey, maybe you save money here that can help you get food. I was going to every food pantry that that would give me something that weren't requesting my income because they see 50,000 and they think that, oh my God, you're making all this money, and I wasn't making anything. At one point, it was the same food banks who see me and they were like, David, we put a couple extra cans of this and this for you and your family. You know, so for me, it really hits home for me when I see that what can this do for us, right? So I'm gonna go in there. What's the average rent here in this area?
About 1,200.
Okay, so we're gonna put that in here. And then we're gonna say no property tax because we're just gonna say that they're renting. Utility and heating, I mean, I'm gonna make it make sense. We're just gonna put, and it's not, see, this is where it gets, so heating and cooling doesn't always be the same. It depends on the season. So what we're gonna do is we're just gonna, just for argument's sake, we're gonna put 100 in each one. Telephone, most cell phones nowadays, it could be $60 to $100, so we'll put 60. Internet, bless you, 100%. And I'm gonna put other utilities. I'm just gonna put $100. Other utilities can be anything else that that we're not talking about. So, I mean, obviously you're looking at the income that this person made. There's not enough money to pay for this. There's no health insurance. We're not going to put childcare. We're not going to put any of that because we don't have any extra money, right? We are definitely under. How much does your household have in their bank right now? Well, we don't really have any money. So we're just going to leave it at 0. And you don't have to answer some of these questions. Do you receive public assistance? I love this question. I prefer not to answer. Because some people don't want to tell you what they have or what they don't have. They just, because it might tie to them. In their mind, they think it ties to them, right? And then at that point, they shut down because now it's not anonymous. Now you're trying to tie something to me because you can take my email, you can see that I'm on public assistance. So just prefer not to answer.
But does that make it seem like too some people are trying to hide something?
No, so I don't look at it as people trying to hide something. I look at people being burned. I always look at the cup as half full instead of half empty. So I used to think that people were trying to hide their information, right? For the most part is you feel like people are selling your information. Now you feel like you're a statistic.
Yeah.
So then you don't want the help.
Yeah.
You know what I'm saying? Because now you're gonna throw it in my face. That's how people really feel like. So they're like, why am I gonna come and ask for help if I feel like you're gonna say, well, you asked for help this other time. So here it tells you, do you want more information on food and groceries? Well, we definitely do. We're going to need for diapers, help with managing our utilities, a change you would like to try, we're going to keep that up. Concerns of child development, no, but family planning and birth control. Now, granted, we don't make a lot of money. So maybe job resources, and I'm going to keep it there at the current moment. So now it's going to say, how did you hear about us to 201 North Carolina? And I'm not gonna fill it says here, please notify me when new benefits become available that I'm likely eligible for based on my information I provided. So anything that I add new, a new agency that they might qualify for is automatically gonna go to them in an email. Please notify me about other programs or opportunities. So within my friend Ben, I'm not gonna do that. If I click on that, it's gonna ask me for my email or an email. And what I had when I was presenting my friend Ben to about 2,000 people, somebody mentioned to me, well, what happens? I'm like, well, create a fake email. Like if you ever don't want something to be able, like what you're putting on, and somebody looked at me like you're telling them to create another email, 100%. Like I have multiple emails. I have an email where like when my wife is, she's a shopper, and they always ask you, hey, can you give us your email for the shopper card? I don't want that to inundate my email. So here, use this email. And we just created a Mercado family household email that you just pop it there, and all of a sudden when you're going to get one of those discounted cards or online right now, they're like, hey, you want an extra 15% if you want your first order? Let it go there. And let it inundate all those emails and that spam mail. It's not going into the email that we currently use. So I always tell people, like, if you want to do that for this, that's perfectly fine as well. So now it's going to make you just review everything that we entered to make sure that it's accurate. Is all your information accurate? Notice how nothing here can tie me to a person, right? So I go through the whole thing. And once I click on the bottom, it says not finding what you're looking for, try calling 211. It's not going to, I'm going to show you what it shows you, but somebody might be like, this is a lot of information. Maybe I want more information. So we're going to hit continue, and it's just going to tell you the same thing again. Please wait while we gather your results. So now it talks about 10 programs found. So you notice how on the left it says long-term, and I'm going to show you an estimated monthly savings, annual tax credit. So going through, and look here, it says if you're a US citizen, if you're a green card, if you're a refugee, undocumented, just in case there's resources that might qualify for you. Somebody's like, well, why, what does that make sense? Well, we're in a different landscape now. And there's people that we're offering services to that might not fall within everybody's service, right? So going through all that, obviously Medicaid. What I like about this, it takes 45 minutes to fill out the application, estimated savings. If I click on more information, it's going to tell me about Medicaid. And if I go to apply online, it took me to the website to apply. So you don't have to remember a website. You don't have to click on anything. You're right here to apply. 2 seconds. Sometimes you're like, oh, as an agency, you need to figure out how to do this and how to get to the next screen. It's all right here for you. We've made it right at your fingertips to be able to help your person that we have. Let me see if I can move this bad boy just for a second to see where we are. Okay, there we go. So here, I'll put this back. I'm going to go back. We have subsidized child care assistance program. I don't know if they're getting any subsidized child care, but they might qualify for what they've inputted in. Right? Same thing. It's a 45-minute. We got SNAP benefits, WIC because she's pregnant. And then obviously the age of the, so it's, you might be able to get $180 worth of food, WIC food for the, and people are like, I don't qualify. Well, you don't know what you qualify, but if you're giving us this as your income, you potentially qualify. National School Lunch Program, because if the child is going to be in school, obviously they can qualify for the free lunch or reduced lunch or whatever it may be. You got your tax credits, housing crisis intervention program, weatherization program, the Lifeline program. So these are statewide programs, right? My thing with this, when I always talk about this, this might take, so like if I apply for food stamps or SNAP benefits, you can get emergency assistance, but that takes 7 days. What do I need today? Like I need something today. I'm hungry today, not tomorrow. So then you go into, so all this stuff on the left-hand side is all about long-term benefits. But now let's talk about additional resources. Now, these are the ones that are near term. Remember I told you that they wanted to do Diaper Bank of North Carolina plant. I already knew what they were going to put here. But for me, Feeding the Carolinas, I can click on it and it's going to take me to their websites. But if you go up here for more local resources, notice how it says local resources, we're going to click on food and groceries. Look where it took you. It took you to our page of 211. And it's going to show you right here, Iredell Christian Ministries, 752 Old Salisbury Road, Statesville offers food pantry with canned goods and dry. So here I can go into this listing. And it shows me the map of where they are. So obviously, let's say that I'm not from this area and I want to kind of see, maybe that's that's down the road of here and here. And then it tells me the hours of operation. So they're open Mondays from 9:30 to 12 p.m., Tuesdays from 9:30 to 11:30 a.m., Wednesdays, and then Thursdays it's from 1 to 3. There's their website. It's open to all. These are the taxonomies. Remember I was telling you guys that there's certain taxonomy tagged to you. So if whatever you put in that application to be on our or if you're already on it, that's going to let me know. Notice how it said volunteer opportunities. Maybe that person that's looking for food pantry might be like, you know what, I'm working part-time and they help me out. I might want to be a volunteer. I want to give back. You know, when I was going to those food pantries, when I was with my children on Thanksgiving, we went back to those food pantries to serve every year. And it wasn't about like and then not only that my kids served, we ate with the people we were serving because we were not going to look at you and like, oh, we're helping you. No, we're gonna really show what this is. So this food pantry is looking not only that they do food donation programs. So let's say a consumer is calling into 211. Hey, where can I donate canned goods? Or where can I make a donation? Well, they take the donation there. They also offer food pantries and volunteer opportunities. So that will get tagged. So your agency can get tagged in multiple things. So yeah, this person's unfortunate looking for food, but let's say if somebody's wanting to donate, this is an opportunity that we can tag your agency for that. And everything here, it just goes visit. So how to apply, you just visit the office, none, there's no other issues. So I can go into the next one. Yoki Fellow, am I saying it right? Yoke Fellow, okay. Offers food pantry, I click on the same thing here. It shows, I'm hoping this is the address there, but we're gonna see. They're on Shelton Avenue. So here, look at now theirs. So their Helping Center Food Pantry is open Tuesday and Wednesday from 11:30 to 2:30 p.m., Thursday from 2:30 to 4, and Friday from 9:30 to 12. Their mobile food pantry, located at Cool Springs United Methodist Church, is the second Thursday of every month. Right? Logan Presbyterian, Scotts Creek from 10 to 12, third Thursday of every month, and Cool Springs Community Church from 12. So this is what they gave us, what they offer, and they offer food pantries and food donation program. So now they didn't ask for volunteers, so they might have missed that mark there, but this is an agency, if they wanted that, and they wanted it to be listed for because we have so many people calling in saying, where can I volunteer at? Well, we would be able to look at an agency that's in the area. Going a little further down, there's their website, visit or call. And then theirs, look, it says documents, proof of address, proof of income, photo ID, and the ages of everyone in the household. The other one said open to all, no restrictions. This one has a restriction. So when our staff is giving that restriction, we're going to tell them, hey, listen, they're just going to need a proof of address that you live in the county. And it's going to say, hey, your proof of your income, photo ID, and ages of everybody in the household. Some people might say, okay, I'm going to pass that one because I don't want to bring all that documentation. But somebody that's really in need are going to look at this saying, hey, I'm going to go. And then the last one.
How do you prove?
Well, it depends. So like on my friend Ben, I told you I was making this much money and I was getting paid weekly. Hopefully, if you're getting paid on the books, you'll be able to show something that you have, whether it's a pay stub or whatever it may be. The other way to prove it is if you're not working at all and you're getting government assistance and they're giving you SNAP benefits, you can take that in that you're making, you can show that in that account that you don't have any income to. So then the last one here to show you just for time purposes is, Yep.
That we want to make sure that.
100%.
Because I know we have agencies, in the room and future asking, how do I turn on and off my NC 211 benefits?
That's easy.
So I want you to walk us through that
Mhm.
and make sure that we know that information. And know that my friend Ben kind of ties into.
100%. So this one here, if we're gonna go right back and we can stay right where we are actually. I like that guy. He's a nice looking guy. So agencies, you go here, when you come into 211, this is our homepage. You're going to click over agency. We made it so easy for you. So you're either going to add your agency, right? If you're not part of our agency group, or you're going to update your agency. If I click update your agency, it's a simple form and it's your contact name, listing information, program, and your suggested edit. So you can say, please take us off of your program listing, right? Or please add this, whatever you need us to do, you need to be very specific there. Because if you say deactivate, we're going to inactivate you immediately. It's not like, hey, it takes 24 to 48 hours. We have somebody working, we're open 24 hours a day, 7 days a week. So the way I did this was I have my resource coordinators working across the clock. So if I have anybody that's handling these, if they're not done and there's, let's say, a shift change, it's not about a shift change, this comes into a general mailbox for our resource coordinators. Next one that's handled, they automatically deactivate or activate or change your listing. Let's say that you're in the middle of a disaster. That's another one, right? We update our resources real time in disaster. So like there's a different spreadsheet. So like this is all web-based. When Hurricane Helene hit, we were updating real time on disaster response. When I sent out to our local United Ways for the SNAP benefits, you remember in December, when they all of a sudden shut down everything for SNAP benefits, I created a resource page specifically for SNAP benefits and for people that were doing pop-up for food. That was updated real time, every day. So if you know that, hey, listen, we're going to change for the next 30 days, we're going to offer this, you're going to put it here in your suggested edit, and you're just going to be very specific. Just put here, hey, I'm putting in here for the next 30 days, we're offering an additional service for food because of the SNAP benefit, whatever it is, that'll get updated in our resources. If you can say, hey, we would like to be active, but we want to take away that we're not offering this service anymore, you're going to update it here. If you have questions, you're going to have a resource coordinator. You can even put in here, can I have a resource coordinator call me?
How do we view our listing?
Yes, I'll show you. So you can put in, so 28677, that's here. Give me a agency that might be here. I don't know.
Fifth Street Ministries.
I'm sorry?
Fifth Street
Okay.
Ministries spelled. FI.
Sorry. It's a C. So it's on 1425 Fifth Street. Lunch Monday through Sunday from 11 to 11:30. Dinner is Monday through Sunday from 5:30 to 6 p.m. They offer a soup kitchen. This is the website. And then I can click to it as well, open to all, and then visit the office.
So if you go back, does it show all the other services that we have?
So let's see.
No, if you go back.
Oh, if I go back to it, let's see. So the Unite Shelter and Veteran,
Just scroll down.
Mhm. My sister's house. Those are the three that we have. And then the good thing about this is, and I'm just going to open one just to see. So this one, hopefully, when it gets to housing and different things, this should have more of an eligibility criteria, or it should be more specific compared to just offering the soup kitchen. So looking here, offers emergency shelter and crisis line for victims of domestic violence, rape, or sexual assault, hospital and court advocacy, case management. And then it tells us the main number. Crisis line is available 24 hours a day, so then somebody should be able to call in to get through. And then it says here, eligibility victim of domestic violence, rape, or sexual assault. So this is what's on the listing so anybody can see. Now, let's say that your agency wanted us to really specifically reach out to somebody. So we do like this one here, we can give this information, but on a crisis call, I'd rather do a warm transfer. Like, like especially if you have a hotline that you have somebody that's manning that line 24/7, you can put in your agency, hey, I would like it to be a warm transfer. They won't see this. They'll see this, and then it'll be, we will refer over while we have that consumer on the line. So at that point, it's not like that person gets less through that, like, oh, maybe because I'll give you an example, domestic violence, it can change like that. So that the person might be outside cutting the grass, or the person might have gone to the grocery store, and you want to be able to see how we can get them in and out to somewhere else, then that's an opportunity that we might be able to help out with. So that's where an agency has to be very specific on what they need. I hope that helps a little bit. Is anyone want to look up another agency?
Well, now I have another question though, back where you had, the refugee and all that stuff.
Mhm.
What if somebody isn't a citizen
So
with
let's-
all that we've got going on now?
Yes.
If they check that, how would that?
Well, the good thing about it, if I went back to my friend Ben results, so I can go here. And now remember, it's only going to show what resources they would qualify for if there was anything available for them statewide. So if I went to undocumented, so they would qualify for WIC because the children would allow them, she's pregnant or he's pregnant, they're pregnant, and emergency Medicaid. So it shows you what they would qualify for based on their status. Do
But it
people?
wouldn't throw up a red flag or?
No, so this won't, where, anything that we do here is not gonna say that you searched anything because of the fact that we don't share our engine with the state government at all. So the way this works is it's just showing them a lot of it, and I'm gonna talk, and I'm hoping, I'm talking from my heart too. I feel from this because my wife is undocumented. We've been fighting for her citizenship for the last 4 years. And since everything that's happened, it's just delayed, 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 delayed. It's terrifying. It's terrifying that when you're sitting, I live in New Jersey, I telecommute, and I own a gym that ICE was literally right 2 doors away from my gym. Like they're just knocking on doors and they're doing whatever, and it's terrifying. So people are not calling because of the fear of giving their information.
Right.
So this is where the agencies have to really push to and want to say everything is information is confidential. We do not share any information with anybody. And if they call in, we're not asking any personal demographics. So they can call in and just say, hey, I just want a resource for a food pantry. I just need this. If we ask demographic questions like, hey, we don't say, are you a citizen? That's the basic demographic questions you're going to get is, can you give us your age? Have you called 211 before? Are you disabled? Do you have health insurance? Because that'll help us determine if we can get you other services. But let's say that somebody says, I don't want to give you anything. We stop asking questions and we go straight to the resource. So just so you know, so 100%, I feel for you, 100% on that one. So getting back to our 211 search.
Highlight one thing. David's right on about taking control over your list. This is your list. You can control it. And that off and on thing that Sarah's talking about, I really want you to think about, like, our family rooms all of a sudden are not available or because of this crazy sprinkler situation. The number one complaint we hear, and it's not really about 211, it's about our agency network. The number one complaint we hear is I called all those places. You gave me 10 places. I called all those places. They're all out of me. Or they can't help me. That's the number one thing that shuts somebody down when they have gotten the nerve up to go out there and ask for help. And so the better job we do taking control over our listing, you're not only saving your staff time from answering phone calls you can't support or you can't help, but you're really helping those people that otherwise are getting 10 places to call and having to go through and hear no 10 times from getting that brick wall experience. And I think the better job we do of that as a system, so it took us a long time. When somebody called, we used to send them to an agency directly. It took us a long time to train our staffs that we were doing a favor by sending them through to one. And that's part of the reason is let's not give them 5 places to call. Let's give them one place that's open when they need it to be and they have the right documentation and get them to that. And so that really depends on each of us taking active control over our
Hmm.
because David is, as smart a fellow as David is, he does not read minds, as far as I understand.
No.
And so he don't know, unless you have it in the system, he has no idea what's going on.
And I think a lot of agencies, and I'm going to speak from just a thought, a lot of agencies feel like if I take away something, nobody's going to use us. Or like, it's like, I'd rather people feel like it's giving you the power to say, hey, right now, like there's certain pillars in life, right? I created pillars at 2 and 1. And then maybe if this pillar is just not working, maybe we just need to stop investing in that pillar and concentrate on the other pillars that we need to invest in, right? So if you guys are offering so many services, but you realize like, hey, the funding for this pillar is just not there, just say, hey, we just want to inactivate this aspect of it. That's it. And when you guys are ready, and let's say you get that grant that's helping you or whatever it is, or that special funding to continue with it. But the more you tell us, the more that your consumers are going to really get the benefit in your community. And that's the hardest thing because what agencies tell me, like, and if we, I had to be very transparent with our local United Ways in our last conference that we just had, our annual conference. I gave them access to the keys. I said, hey guys, you get to see the back end of our system to show who's active and inactive. Since I had that conference, I've had so many people call me like, but I know that these are active. I'm like, have a conversation with your agencies. Like I can't take as much as and Brett's on my board. As much as I can have this conversation with Brett, I still need to be able to go and have the conversation with the agencies. Doesn't have to be a phone call, it could be an email. Hey, our listing has updated. And because we say and we vet it and say this has been verified. I don't know how many of the agencies here have used the Unitas platform. Have any of them used the Unitas platform?
There's about 5 or 6 that are, yeah.
Okay, so I'm gonna say it for purposes of also the recording. We were implementation partners of NC Care 360. We were the navigators. What I mean by that is if we got a referral from a hospital or an agency, we were the ones actually reaching out and helping them. The resources weren't updated in the platform. So the issue that we had was we were old resources here. So we were giving out of network resources, our resources. And 96% of the resources we were giving were from 201. And people were like, thank you, they're helping because they were vetted and they're checked yearly. What happens is some people create these resource banks and they don't check them and they don't update them. And they say that the agency is responsible for doing it. Yes and no. Some agencies don't have the capabilities or the staffing to do it, but that's where we push it. And if we can't, and we don't just try one time. If your month, like let's say that I just added you today for Fifth Street today, you were added today, we're not gonna check you again until 9 to 10 months. And in that 10th month, we're gonna give you 30 days to respond to us. If you do not respond to us within 30 days, we're gonna inactivate you. But we're going to send you an email saying we inactivated your listing. We would love to reactivate your listing once you just communicate us everything is still the same. And then people are like, oh my God, I was inactive. I was checking. Okay, it's just a simple conversation. Let's just go through it. And then all I do is pull up their listing and say, is this the same? Is this the same? Has anything changed? Now, oh, that did change. We don't offer that anymore. Okay, perfect. I'm glad that we inactivated you so that we wouldn't send somebody there to you. So that's really, really important when it comes to our website. And then adding and changing is easy. It's as simple as can be. The moment you submit it, I'll get the email within seconds. I'm on it, the manager's on it. If she's not available, I can jump on it. One of her staff can jump on it. But the best thing to do is if you have questions, say, hey, I need a phone call. Put that in there. Hey, this is my updated listing, but can we discuss it? They'll call you. And then if you want to be that person or your agency, let's say that you're not at the office because some of you guys have other jobs too as well, depending on the agency or volunteers, they can say, call this number for the update of the agency. Because right now, if your agency is only open Tuesday through Thursday and you're sending this Thursday night, well, is there a phone number we can call on Friday to get that listing? Or Tuesday, do you want to schedule something? And you can be very specific. Can you schedule a meeting with me on Tuesday at 10 o'clock? And we will make sure we're on that call with Tuesday at 10 o'clock. There's plenty of staff. It might not be your coordinator because your coordinator might be in a meeting with somebody else, but we will make sure, and it might be me. You might be like, man, I'm talking to David. Yes, you are, because of the fact that we need to make sure that if an agency is asking for help or they want to update, we want to make it easier And we don't want it to go through like red tape to be able to update your listing. So we made it as easy as possible that you just fill out a quick form.
One last question,
Yep.
that I have, I wanted to cover for the agencies that I've had people ask me. What is your process? And we kind of have touched on this, but what is the process if somebody is writing a grant request? How can I get more evidence to support that? What is the process?
So I'm gonna give you the greatest process is partner with your local United Way first. So you're gonna partner with Brett and his team. Because,
Sarah, call Sarah.
yeah, reason why I say that is because they're your champions. So you're gonna partner directly with them because any of the data that we're gonna be able to provide in analytics, we're gonna give to them. That's our partnership. And I'm not saying that we're not partners with agencies, but we can't support you. But the support comes through our local United Ways. Like they are our champions. They are the spearheading this. If you notice how we say it's driven by the local United Ways. So any of this data, any analytics that we have is going to go through them. Doesn't mean we can't give it to you. Yeah.
And I'll just be honest about how we're gonna think about it, like if housing data is requested, let's say. People wanna know, well, what's going on in housing in Ireland County, who's calling for what? We're happy to have that conversation with NC 211, get that data, but we're not going to restrict that data to just one agency part. So we would share housing data with everybody that's doing something with housing. You know, if we get a good data set, we're gonna send it out. So don't call me and say, I want the competitive advantage in this grant process. Can I get your 211 data and I'll be the only one to get it? The answer to that is probably no. But we're happy to share data to the community about issues that are going on in the community as best we can, any way we can. 211 is a great resource for that, but there are also a lot of other resources we have for that, and we're always willing to share that data widely.
Yeah.
That's part of what we are, is a good source, and that's what the county contracted us during COVID-19 to do, is be the resource about what's going on in health and human services in Iredell County. Because we work with so many of you guys that we're able to have a different perspective than any one silo.
Yeah. And then, obviously there's agencies that want specific data, like very specific data, and I want to say analytics, because data and analytics is completely different. So at that point, you would still reach out to your local United Way because of the fact that we're in a partnership agreement. Like we're currently working through what it looks like for a partnership agreement. Like if you want to be a partner of 211, doesn't mean that you're paying into 211. It means that, hey, so we're working through the analytical process of this, right? So in the future, like where small agencies might say, hey, I want X, Y, and Z because I know that I can put this into my grant. Then we can have that conversation, right? But the main person here that you need to go through would be Sarah and Brett. You would go and say, hey, listen, do you have this data? Because they might already have it because we send them so much. Let them be your champions in your communities, right? Like, and I say that because I give you my card. I'm always open. The first question is if you ask me for something, I'm like, not a problem. I'm going to have a conversation with your local United Way. I say this across the state and everybody's like, oh, but why can't I go directly through you? Because of the fact that it's a funneling system that we're a network. So I hope that helped answer that question a little bit. Now I'm going to leave it open. Obviously, I can't give you guys any questions, but I mean, I'll make sure that Sarah gives you guys my information, that you guys can ask any questions to me. Anybody here have any specific questions?
And not about 211. David was a baseball player. If you have any baseball related questions, you can throw those in the mix. There's,
I was many moons ago. Now I'm just I'm an awesome father, husband, and I'm training for an ultra race, 100-mile race. So that's what I've been running and training.
I'm just saying.
Well, we're getting there. We're
So if
getting
you'd like to check on his mental health, this is not.
This is the time.
A bad, I don't know, that's a symptom of something.
there. Yeah, listen, when I'm visiting the Carolinas, you guys got a crap load of hills, man. My wife's like, how's your run? I'm like, a lot of hills. But the good thing I love about traveling through the state is I'll be in Statesville today. So my run tomorrow morning will be through here. So my run tomorrow is 18 miles. So I'm going to enjoy 18 miles of something. I don't know what, but my phone tells me where I'm running.
We're going to lunch with Genevieve. I'm sure she has an 18-mile track. She's a lot faster.
I love it.
Yeah.
Well, awesome. So I will stop. You want me to stop the Okay, I'm going to stop sharing first. Oops. Stop the share. Now I'll pause the recording for you. Or you want me to stop it? Is that fine? Okay, there we go. Yes.